Hey everybody, it's Dr. Dave, Psychiatry. Thanks for coming to the channel today. Saw a patient yesterday who, first thing he said was, I just never feel so good in the wintertime. And we talked about what we are going to do for him, went over his symptoms, made a decision about his medication. Obviously, he's taking brain chemistry medications, so making an adjustment to that is what we decided to do. We don't always do that, but we did that for him yesterday. But at the end of the visit, he said, hey doc, why haven't you done a video on that topic? And I said, you mean seasonal affective disorder? He said, yeah, I think there's a lot of people who don't feel so good in the wintertime. So I came to the office early today and just want to jump on the video and shoot a quick one for you guys so you can hear my thoughts about how do I approach people feeling worse in terms of anxiety, depression, things like that in the wintertime, which is known as seasonal affective disorder. So seasonal affective disorder is something that really came about during my professional lifetime. I'm not exactly sure when it hit the DSM. And, if you want to research that and do a wiki on seasonal affective disorder, you can look it up. You can post in the comment section if you want to be helpful, because I got a bunch of patients to see today, so I'm not going to be able to do that. But it's something that I think it was recognized professionally that this is a common occurrence. But I think the idea there, when it's called seasonal affective disorder, it implies that there is a cause between the seasons and the mood disorder. My feeling is that it's more a relationship and an occurrence and a contributing factor, but not really a cause. If you've watched the channel, you understand that my fundamental understanding, my fundamental belief in what I teach about how you think, how you feel, how you behave, all relates to your brain chemistry. So then there's other factors involved. There's personal stress, financial stress, there's sleep stress, there's physical stress, and there's also, I guess, what you'd call light stress. I haven't really called it that before, but that's really what it is, light stress. Humans are optimized to be daytime animals. There are other animals that are optimized to be nighttime. For a cat, big eyes, likes to prowl at night. Cats, that's sort of their natural environment, being predators at night. Humans, we're optimized to function during the day, and we just don't function as well at night. So fundamentally, we use light as part of our daily optimum functioning. And, you'd have to, if you've ever had experience working a night shift, which as a doctor, pardon me, which as a doctor, I've had a lot of experience having to work night shift. I know that I do not work well at night. It's just something that I know. And people that work night shift that I take care of, it's always a constant stress that they have to shift between their night work and try to have day lives, because a lot of other people, a lot of their friends have day lives. And that transition between day and night is really difficult. So in the wintertime, and this is winter, people complain that the lack of daylight, particularly in the afternoon, is really hard on them. So just a little astronomical background, because this is, for some people, this has become as much of a podcast as a video, some people to listen to these. In my latitude, the earliest day of sunset is at 4:32 in the afternoon, Central Time. So where I live, that's the day that I track. And that happens typically the first week of December. So even though the shortest day of the year technically is December 21st, which is coming up here pretty soon, I film these ahead of time and then I post them, so that's a little insight into the backstory of the channel here. But when we start to get at that middle week or early week in December, that's when the sunset stabilizes at 4:32. That means that's the day of earliest sunset. Now, the sunset is actually, in our latitude, is not the indicator of the shortest day. The shortest day, the mornings become shorter and shorter and shorter up until December 21st by subtracting time from the morning. But in the afternoon, 4:32, once it stabilizes there, and as of a couple days ago, the sunset is now a little bit later, so 4:33 for a couple days and 4:34. So it's actually, even before the shortest day of the year, the afternoons, which is what most people experience as their day being short, it starts to get longer. So I'm always happy when I hit that first week of December and the sunsets aren't getting any earlier anymore, and I'm gonna maybe see the sun before I get home someday. So we're in that season right now where the afternoons are short, so people are not getting as much daylight. Now, what do we do with that? If it's really true that humans are sensitive to not having enough daylight, well, the decision has to be made, do we change our medications? And sometimes we do. Like I said, the fellow I saw yesterday, we made a slight adjustment, but it was with a caveat that it may help or it may not, because truthfully, it's sort of like if you're just super tired, how do you feel? If you've had an extra long work week or an extra long work day, or you've had to do a lot of physical stress work that you don't normally do, how do you feel after that's happened? Do you feel as good or not? Well, if you imagine that the stress of having low light is something that you endure really for months, well, that just becomes fatiguing. And so I think really what happens is people become fatigued. Now, do we change our medicines? As I said, sometimes we do, sometimes we don't. But I don't think that it's, in my experience, I don't believe that it's true that short daylight causes a brain chemistry problem. As I've taught on many of these videos, your brain chemistry comes from your parents. It's your genetics. You get it, your brain chemistry, like your skin color, your hair color, your eye color. That's what makes it medical, not mental. It is a medical problem. And if you have that medical problem, what I would say is that, honestly, if your chemistry is, should be here and it's here, well, you're not going to deal with that light stress as well. If your chemistry is here, if your chemicals are in the good normal range, and if you're listening to this, I'm holding my hand showing the normal range with my left hand and showing where you are with the right hand. If you're in the middle of that normal range, then you're going to deal with lots of stuff. We've talked about, does stress cause anxiety and depression? The answer is no. Stress is something that you won't deal as well with if you're not in the normal range, if your hand is below the normal range. So as I'm describing that for you, I just want you to understand that light stress to me is pretty much like any other stress. It's something that if your brain chemistry is not good, either too low or too high, you're not going to deal well with the stress. And if you're optimized in the middle, then you can do as well as you can with that light stress. So the decision you make with your doctor, is it really worth changing your medicine, or is it really just accepting the fact that you have that light stress through the wintertime, and that's why you don't feel as well, and it's something that you have to become accustomed to, endure, coach yourself. And it's an example of, we don't give a medicine for everything. I mean, if this is what you sort of consider normal, well, we don't give medicine for normal. We give medicine for abnormal. So again, shortage of light is sort of a contributing factor, but not always something would change your medicine for. Now, what do I do in my office? For me personally, I'm from New Mexico, and I'd have to go search this. Again, I'd have to get on the computer and search Wiki how many days of sunlight in Albuquerque, New Mexico, where I was born. But it's a lot of days of sunlight. I think it's over 300 days of sunlight. So I was born and raised in a place and lived the bulk of my early adult life in a place where the sun always shined. And so I just am very comfortable, happy. I like sunshine. Back in the day when tanning beds were, not such a bad idea, I'd lay in the tanning bed just to have that light hitting me. And that reminds me of what I'm going to talk about next, the tanning bed. This is sort of how you discover these things. If you feel better after tanning, a lot of times it's because you're getting a lot of light, and it even penetrates through when your eyes are closed. It penetrates into your brain through your optic nerves, and you get the sensation of light. And if you've ever done that, you know it. But you don't have to be in a tanning bed. In fact, we don't recommend tanning beds anymore because of the whole skin cancer deal. But I would say, if you haven't done this already, I'm going to teach you about this. This is what I call a grow lamp. So back in the day, honestly, in the early 90s, late 80s, in our trade magazines for psychiatry, you could buy what was called a light box. And a light box was basically a wooden box with a light bulb inside it and a lens and a switch. And doctors would literally, prescribe or tell you that you need to go spend $300 or $400 on a light box. And doctors would say, sit in front of that light box for at least an hour a day and get that natural light in your system to simulate that the days are longer. Well, that's a really good idea, but you don't have to spend $300 or $400 on a light box. The reality is, you can go to your local hardware store. I get these at Lowe's. Now they're expensive. They cost about $8, I think. When I bought this, it was about $7 or $8. And you can't see on the camera. It's got little diodes in here. And instead of being what you'd see a regular or common light, this has little diodes in it that emit the ultraviolet light that is natural for being outdoors. So the daylight spectrum that you need to grow plants indoors is in this light bulb. And I first discovered this because I had a mentor decades ago, actually, who used to grow orchids inside, and he had these what he called grow lamps, and the grow lamps basically they're simulated daylight. So I have a lamp in my office that I just screw in, and it sits there by my desk all day long. So in summertime, I leave it on. In wintertime, I leave it on. And this gives me at least some extra daylight during the winter months. So that's not a bad idea. It's not going to cost you a lot of money. Some people actually buy 5 or 6 of these and put them in their fixtures all over their house, and they leave them on in the evening to simulate daylight being longer in the wintertime. So those are my ideas about seasonal affective disorder, those words meaning that you have affective mood problems during the seasons, and that's to signify the winter months. And honestly, as much as it is a diagnosis that's in the DSM, my feeling is that it's rather than a different diagnosis, it's a contributing factor to the other brain chemistry problems that control how you think, how you feel, and how you behave. So those are my thoughts on that. I hope you learned something from that, and I hope that your winter time is not too unbearable as we all look forward to the days getting longer, which is currently happening right now. So thanks for coming to the YouTube channel. Thanks for coming to see me. I'm Dr. Dave, Psychiatry. We'll see you again.